Today, we'll be seeing about the pulpal diseases and sequelae of pulpal diseases. Here is a flowchart that summarizes the entire sequelae of events starting from dental caries involving the enamel, dentine, pulp, supporting periodontal region, and finally it can lead to either an abscess or a dental cyst. This is a clinical photograph showing dental caries involving the enamel, which can be appreciated as a discoloration or a catch is felt on the enamel surface on probing. If you can see the radiograph over the right, no changes are evident. In this condition, the patient is also asymptomatic. From the enamel, when the caries proceed to the dentine, then patient will experience severe sensitivity on probing or on exposure to hot or cold due to exposed dentinal tubules. If you can see the radiograph over the right, it shows radiolucency involving the enamel and dentine. Involvement of the pulp leading to inflammation is called pulpitis, and pulpitis can occur due to varying causes such as sequelae of progressive dental caries, iatrogenically during placements of restoration, accidental exposure of pulp during cavity preparation, and trauma of the tooth leading to fracture of the crown and thereby exposing the pulp. The pulp undergoing necrosis is called as a non-vital tooth. Basically, an acute pulpitis and a chronic pulpitis has varying signs and symptoms. Pain is acute, continuous, lancinating, increasing on lying posture, aggravated to heat and cold in case of an acute pulpitis. If you can see a radiograph on the left, it shows radiolucency involving the pulp with no periapical changes. On the contrary, in a chronic pulpitis, clinically and radiographically, there is a wide open carious lesion with dull intermittent pain. Once the inflammation and the infection crosses the periapical foramen, then it involves the surrounding periapical region. Then it is called as a periapical periodontitis. In case of an acute periapical periodontitis, there is pain on probing, tender on percussion of the tooth and palpation over the alveolar mucosa. The tooth seems to be slightly extruded from the socket with an accompanying regional lymphadenitis. A radiograph of an acute periapical periodontitis will show a radiolucency involving the pulp along with a widening of periodontal ligament space. Suppuration in the periapical region can occur following a periapical periodontitis, which can lead to an accumulation of the pus and which is called as an abscess. If the collection of pus in the periapical region with a mild bulge over the alveolar mucosa, then it is called as a periapical abscess, which can again either be an acute abscess or a chronic abscess. If it is a localized intraoral swelling or an extraoral swelling as shown in the diagram, then it is called as a dentoalveolar abscess. If it is a diffuse extraoral swelling as shown in the figure, then it is called as a cellulitis. However, the radiographs of all these three conditions are more or less similar, with a radiolucency involving the pulp, widening of periodontal ligament space, loss of lamina dura with or without a periapical radiolucency. If you have seen so far is an acute sequelae of events. Now we are going to the chronic sequelae of events. If the virulence of the organism is decreased and the immunity of the individual is high, then there could be a long-standing intraoral swelling with a sinus opening as seen in this clinical photograph with discharge of pus, and this is called as a chronic periapical abscess. A tooth with a wide carious lesion without any clinical signs and symptoms. However, radiographically, as you can see in this mandibular molar radiograph, a well circumscribed periapical radiolucency of less than 0.5 centimeters, then it is called as a periapical granuloma. A long-standing periapical abscess or a periapical granuloma can undergo a transformation to a fluid-filled pathological cavity, which is called as a radicular cyst or a dental cyst. Here, the patient will have a slowly expanding, painless bony hard swelling in relation to the carious tooth or the non-vital tooth. And this, as shown in the diagram, is a clinical photograph of swelling in the maxillary anterior region, and there is also a radiograph of the involved tooth, which can be seen as a well circumscribed radiolucency measuring more than 1.5 centimeters surrounded by a radiopaque border. Finally, to recapitulate this, the flowchart depicts the turn of events both in the acute phase and in the chronic phase following a pulpitis.